Can you see my screen, Andrew?
We can see your screen. Thank you very much. So
Fine.
I will introduce you. I'm pleased to introduce Professor Wyman Chan. Dr. Wyman Chan, BDS PhD, is a dedicated clinical teeth whitening and research dentist practicing in London. For over 20 years, he has worked with all major home and power whitening systems. His PhD in efficacy and safe teeth whitening processes led to 7 UK and US patents. Dr. Wyman Chan has discovered the important phenomena in the texture of teeth and establishing protocols that have contributed to the movement in safety and efficacy of tooth whitening processes. He published important hypotheses in tooth whitening processes which help evaluate the texture of tooth enamel. Dr. Wyman Chan is well credited as the inventor of painless teeth whitening techniques and products. He was appointed as a clinic associate teacher at Warwick Dentistry, the University of Warwick from 2010 to 2016. He peer reviews for the British Dental Journal and has contributed to a book, The Art of Treatment Planning, Dental and Medical Approaches to the Face and Smile. That was Quintessence Publishing, October 2010. Dr. Wyman Chan's expertise in the field of teeth whitening in London is unparalleled, having treated over 16,000 cases in his London teeth whitening clinic and trained over 10,000 dentists from all over the world. Dr. Chan has appeared on BBC's The One Show, The Truth About Your Teeth, Fake Britain, Radio 5 Live, and Sky Living. The lecture today is the important role of teeth whitening in aesthetic dentistry. Thank you, Dr. Chan.
Thank you. Okay, thank you. Good afternoon, everyone. The time zone is different. Yes, I'm really honored and delighted to share some of the insights of teeth whitening with my colleagues. I graduated from Guy's Dental Hospital many years ago, and I did my PhD at Bolton University, which is the efficacy and safety of teeth whitening processes. I think I've been introduced. I have many more patents since Andrew introduced. I have 14 patents been granted now. And as I said, I train many dentists all over the world. I'm an inventor as well. I'm the founder of Perfect Trays, which is amazing bleaching trays and also whiten teeth whitening products. So in my own clinic, I only use my invention. So these are some of my inventions. And year 2002, that is a landmark for me, because that year I opened a dedicated teeth whitening clinic in central London in the West End at Shaftesbury Avenue. At the same time, I decided to hang up my drills. So I stopped becoming a normal dentist 19 years ago. I just dedicate myself to do teeth whitening. That's what I do all day long. Every day, apart from teeth whitening and in the clinic, I do research as well in the lab. So to date, I've done over 20,000 teeth whitening procedures. I think today we talk about aesthetic dentistry. So how do we improve the aesthetic of these teeth? This is a very, very typical baseline color, where somebody never had any aesthetic treatment done but before. The color of the canine is about B3. Usually is many shades darker than the anterior teeth, than the centrals and the laterals. This is very, very normal. Canine teeth are usually many shades darker. I think we dentists notice that all the time. And also that was the simple teeth, that's yellow teeth. How do we improve the aesthetic of these teeth? With severe fluorosis on the left side and severe tetracycline stains on the right side. So how do we make these teeth look nicer? But firstly, let's look at what is an ideal dentition. We always talk about an ideal dentition. It's got to be functional. It has to be able to eat and bite and chew properly. It's got to be healthy. The teeth got to be healthy. Not only the teeth, the surrounding tissues and the supporting tissues got to be healthy as well. And when we talk about aesthetic dentistry, then we talk about they have to look nice and beautiful. They must aesthetically pleasing. This is an ideal dentition. But how many of us have this? Really not many. The percentage is very, very low for anyone to have an ideal dentition. Okay, so and that's why we do elective aesthetic dentistry to make the teeth look better without compromising the health of the teeth and the surrounding tissues, and also without compromising the functional effect of the capability of the teeth as well. So what are the treatment they are? We could align the teeth if they are not straight, if they are crowded. So the most common is align the teeth. And also we change the tooth or the teeth shape. If it do not look good, we change shape as well. This is the aesthetic dentistry. Also, we change the color as well. The color is not bright enough or not too white, and then we change the color. This is the traditional aesthetic cosmetic dentistry. That's what we do. So what are the methods of achieving alignment, align the teeth and change the shape of the teeth and also change the color? So we have in our tools, we have a lot of things we can do. We can do restorative dentistry. So we can align the teeth with restorative. We can do all three. You can align the teeth if they are not too crowded. You can change the shape of the tooth as well, and then you can change the shade as well. And what do we do with that? So with a minimal invasive technique, we can use composite veneer. So provided we do not compromise the health of the surrounding tissue, I think this looks pretty good. We can use porcelain veneers as well, minimal invasive, or we can go for the more invasive technique, which are porcelain crowns. The crowns here looks really nice. And what other method can we do to do aesthetic dentistry? We can use orthodontic method, but orthodontic is limited. We can align teeth. We can change the shape of the tooth by intruding and then extruding the teeth. We can change the shape of the teeth. But with orthodontic treatments, we cannot change the color of the teeth. Yes, some of the colors may become like white patches, but that was not intentional. So basically, we can do 2 out of 3. And chemically as well, we can change the teeth, make it look nicer chemically. Chemical means, what do we mean by that? We can do teeth whitening. Teeth whitening is limited as well. Only can change the shade of the teeth. We can make the teeth brighter, whiter, but we cannot align the teeth. If they are crowded, we cannot change that. We cannot align the teeth. If the tooth shape is not an ideal shape, what a good shape we want to change, we cannot change that as well. So teeth whitening is only limited to changing the color of the teeth. So what is teeth whitening? Teeth whitening represents a bleaching process that removes stains and enamel in the dentin, in the enamel and dentin of the teeth. So the active ingredients of is hydrogen peroxide or carbamide peroxide, which is commonly used by the dental profession. So, and there are many ways of doing teeth whitening. These are the most popular ways. There are many other ways. You have in-office bleaching, you have home bleaching or whitening, you have internal bleaching, and you can do the combination of the above 3 together. You can do it in any sequence you want. So there are many ways of doing teeth whitening. I think a lot of you probably have done teeth whitening, and many of you may be very experienced. I think if you do some teeth whitening, or you've been using it a certain way, if it works in your hand, advise you to do not change. Stick to something that really works. But if you think that you're not happy with the result you have, you think that you want to do better, you can always consult me. I'm more than happy to help. And hopefully you can learn a lot from this webinar. So what is in-office bleaching? In-office bleaching, in fact, is something we do in a clinic. Normally, we're using a more concentrated gel, peroxide gel. You can buy up to 40% hydrogen peroxide within the profession. But if you are from the EU, we are limited to only up to 6%. It doesn't matter what we use. And it depends on the system you use as well. Some system they use isolation dam, and some do not. It depends on what you use. If a concentration is very high, obviously they will use something to protect the gums. If the concentration is low, like in UK, only 6%, maybe we don't bother because it's so weak. And there are also many different types of teeth whitening devices. This is a good time to go back to, I think history is important. We would look at how in-office whitening was started. In fact, it was started many, many years ago, over 100 years ago. But when it became modernized, when it became using a machine, that is when in the 70s, a company called Union in the US actually invented a bleaching a device. They are using heat. So in those days, the first really talk about advanced machine in those days are using heat, and they are using hydrogen peroxide liquid in those days. It's not gel as well. And then we move on to 1997. That's when I got excited about teeth whitening because of it introduced to creative using a plasma light. It's a curing light. You can use it as a curing light as well as a bleaching light. So really we're excited, and we're one of the pioneer dentists who started this. I got even more excited in 1999 when this happened. Bright Smile actually brought in the first bleaching lamp. I think this is an amazing invention. This is the first time we dentists do not have to put our fingers into the patient's mouth and then we can make a living. Then we would paint a gel, we put a machine, and the machine is 3 times 20 minutes initially. So it's an hour, we don't have to do anything and we get income. I thought this is an amazing. I got really excited about this technology in those days and started researching into this and doing a lot. And then this is my invention. In 2007, I actually went back to heat. From heat to plasma to laser, blue light, I went back to heat. All these are heating devices. This is the high power, the Y10, and this is my latest, Dr. Wyman Chan. We call it the Get to Smile device. Professional home whitening, it was started in 1989 when Haywood and Heyman published a 9-guard vital bleaching at the consensus in March 1989. This is when everybody got excited about teeth whitening because this is the first time we have proved that carbamide peroxide, they're using 10% carbamide peroxide in a mouth guard and then actually make the teeth whiter. But before that, in 1968, an orthodontist by the name of Krusmir already doing it, and he's been lecturing in his study clubs. And that was until 20 years later that Haywood and Heyman and knew about this, and then they actually went about and proved that the 10% carbamide peroxide actually do whiten teeth, that does whiten teeth. And most dentists think that teeth whitening is very similar, very simple. I used to think the same. In the 1990s, when I started doing home whitening, I thought it was quite simple, really simple. What I had to do is take a set of alternate impressions, send to the lab, get my bleaching trays done, and get my patient some gel, and keep my fingers crossed, and hopefully the teeth will go white. That's what we used to do. I'm sure lots of us still doing the same thing. And so home whitening, that's what it is. Let's use some peroxide gel with some bleaching trays. There are so many different systems in the market. And in office, what is an office? So dentist thing is very simple as well. It's the use of peroxide gel, but this time it depends on the concentration that we use. If we use very high concentration, like the commonly used internationally, is about 35% hydrogen peroxide, and that is very caustic. We should use protection to protect the gums. And dentists say that it looks very similar. All the systems look very similar. So what are the indications of teeth whitening treatment? As long as the teeth are natural teeth, it will work. It doesn't matter what they are. It doesn't work on artificial teeth like crowns, veneers, dentures. They don't work. And fillings, they don't work. So let's look at the problems and risks associated with teeth whitening. I think the most common we see is inconsistent and unpredictable result. That yes, we do teeth whitening. We always keep our finger crossed and just hope for the best that will produce result for us, and the patient's happy, and then we feel comfortable. The second problem is the result. Yeah, we do have result. I'm talking about especially in the in-office whitening. Yes, we have result. At least 80–90%, we see very good, not just result, very good results. The problem is that they don't last long. They fade back rapidly. That is a problem. That result, but did not last long. And also we have problem with sensitivity as well and pain. So that's why many system, they actually they advocate the use of analgesics or desensitizing agents before or after treatment. So ibuprofen is very common. I used to use that when I was started doing teeth whitening over 20 years ago. I wasn't experienced. Now I hardly use any of these products. Yes, I used to use potassium nitrate as well. I'll put it in the whitening trays if I have sensitivity. But now the more experienced you are, and then you don't have to use this kind of materials anymore when they become really experienced. But when they're not experienced, I think it's helpful so that your patient will feel comfortable. The loss of shininess on the teeth surface, and this happen especially when you do in-office whitening as well. And also, I think the fifth one is very troublesome. Damage to the gingival and or soft tissue. Now, this is actually published 13 years ago in an Australian dental practice and in a journal. The use of the 35% hydrogen peroxide in office, they found that this is what is read. The white area on the gingiva are caused by the irritant effect of radicals from a bleaching gel that have leaked onto the tissues during the procedure. I will raise my hand up. This happened to me before, not once, many times when I was inexperienced because the dam wasn't put on properly, it wasn't stuck on properly. It can happen. If you're not experienced, it can happen. So then that's why these dentists are very modest and actually they put it in the article and warn the fellow professionals that this can happen and please be more careful and do the protection, the isolation better. So I'm sure it happened to everyone, whoever has done in office, must happen to everyone. If it happens to me, it can happen to anyone. But this is more severe. When it's not done properly, you got a very severe burn. This is the loss of tissue. Obviously, this hasn't happened to me, but it is very serious. Also using 35% hydrogen peroxide. And this is at the exhibition. I see that all the time. I go around the world and people using 40% hydrogen peroxide. I think the protection is not enough, and the lips got burned. So it's very common. You see this. Is if this can happen to a teacher who is doing a demonstration at the exhibition, supposed to be a very experienced dentist, and what hope is there for the rest of us? So it can happen. So don't feel so sorry if this happen. But we can prevent all these. What I show you is preventable. All can be prevented. And fortunately, this wasn't done by a dentist. They actually were done in Scotland, in the UK. And this happened actually in the hairdresser. A hairdresser doing teeth whitening. It was very popular in the UK. A lot of non-dentists were doing teeth whitening and using very high concentration, using 35% hydrogen peroxide. And the patient actually done by her friend, a hairdresser, and she posted onto the website and asked people to not go to the non-dental or professional. What happened is that the gel leaked to the soft tissues and the lips got inflamed, and that's why the lips become so swollen. This is 24 hours after. So if all this can be prevented, all I want to show you, all can be prevented. All this now, if you do it carefully and do your SOP properly, all this can be prevented. And many of my colleagues ask me, what method do you like to do? I like to do combinations. I like to do in-office, and then I like to do home bleaching. Sometimes I do in-office first, followed by home bleaching. And sometimes I do the home bleaching, followed by in-office, and followed by home bleaching. So there are different ways of doing teeth whitening. I think what works in your hand is most important. If you get good results from certain method, just continue with it. Unless you think that some other method can get you a better result, then you always can try. You always can try. There's so many different ways of doing teeth whitening. The standard operating procedure, just go through what I do when I do teeth whitening. Photos are very important. I normally take 4 photos. What I do, I take a photo using a shade guide, which is the Vita classical guide, and from the B1 to the C4. So this is, I usually put a tag opposite the centrals. So this is as a guide. I'm not doing a shade taking here. This is only a guide of the color. I realized after I've done so many cases that 80% of the centrals are usually A2 if they haven't had any aesthetic work done before, and 95% is fall within A1 and A3. If you use A2, you can't be far off. We're not taking shade. We just have a guide so that we know what color they are. And the laterals and the canine, 80% is A3.5 B4, so you can't go wrong. And then it's about 95% between A3 to A4. If you use this shade guide from A1, A2, A3, A3.5, A4, you can't go wrong. So at least we will see a guide that gives us the what kind of color they are and how close they are to A3.5 and how close they are to A2, because tooth no tooth is A2 color. So teeth have many colors. And then I take a full mouth with all the gums I want to see, just in case the patient complains that, oh, you damaged my gum. At least you have that before photograph to show that, no, I haven't, because your gums look exactly the same as I did it before. And then I always take a portrait as well, so I can see before and after. Okay, in my clinic, I work 2 days in my clinic now. I cut down a lot. I used to work 3 days, 3.5. When to come to my clinic, I don't just do teeth whitening. I do aesthetic and dentistry. So I ask my patient to choose the color. I give them a shade guide. Normally, I give them up to B1, a normal Vita classical shade guide. If they say the B1, and some people they want the teeth to go really white. They ask, do you have anything whiter? Only then I take the OM 1, 2, 3 out. But normally most people are quite happy with B1. But at my clinic, 95% of my patients they want whiter than B1. So from a B1, from the data, I have the big data, the 20,000 cases I've done from B4 to B1. It's not difficult. If you use the right technique, use the right products, you can get it usually between 2 to 4 weeks. Yeah, it's quite predictable. So I always show them when they want a B1. So I take a B1 out from a shade tag and put it next to the B4. At least the patient can see the contrast between the B4 and B1. If he's B4 and then B1 is so far away, they have to look here and then look over here. And they find it difficult to comprehend how white the teeth have gone to. So we've got to put them side by side. Then they can see really, really clearly. Okay, so how do we improve the aesthetic of these teeth? This patient come in quite young, it's only 21. And she say she only want to whiten her teeth. She's not consider any, I'm not worried about the mild crowding, not worried about that at all. Only she doesn't like about the color, especially the canine. She says it's too dark. When she take photographs nowadays, the social media days, it show up with a good lighting. So she doesn't like all this color. Now, in old days, not that bad, but nowadays it show. A lot of my patients come in because they do a lot of selfies, they do a lot of videos, and they could see the teeth are yellow. So how do we do? We just do 2 weeks teeth whitening, and I think the result is pretty good. So from A1, B2, we go to OM2, and then from a B3, you go to OM2, and then the worst one is OM3. So I think it's pretty good. And then we've used this is the crystal eye, the spectrophotometer, which you can tell me how many shades the teeth gone whiter, gone 18 shades whiter. And we can do from here, we can see the full mouth. That's why I always take a photo here with a B3, and then I'll always take the after photograph with the same shade tag, so that the patient can see the contrast. I know this gone to OM2, OM3. If you put an OM2, OM3, the two photos, they really do not look that impressive. If you put a B3 next to the whitened teeth, they look really, really impressive. So how do we improve the aesthetic of this? Joe is very young. When he came to see me in 2010, only 15 years old, and the mom came with the mom said, I just want to. Joe is not happy with the color of his teeth. Just want to improve. So we did 2 weeks as well. I think the color was also amazing. From B3, also gone to OM3, OM2. I think the color we can produce this kind of result day in, day out, and it's 18, 19, about 18 shades whiter. Before and after the contrast. So people say that, oh, it's different color. Yes, because the setting is different, it's another time. But the most important is the contrast. People can see the contrast of that. So that is very close to B3, but that is so much wider than B3. And a 19-year-old did it 2 years ago. It was really good. Came in with an A2 color. When we finished, we've gone to an OM2, also 15, 16 shades whiter. And this is his sister. We did it start with A2 as well. And then when we finished, it's gone nearly about OM1. So many, many shades whiter, 13, 14 shades whiter. So only 2 weeks. How do we also improve the aesthetic of these teeth? Yeah, we can see slight crowding. Tom said that he only wants his teeth whitened. Hasn't got money to do the rest of the work, to align the teeth, orthodontic treatment, all that. Hasn't got enough money. So just want to do the first step, just have the teeth whitened first. And then from our spectrophotometers, we can analyze the teeth. We saw that the canine is A2 and the centrals and the laterals A1. So we just did one treatment, which is 2 weeks. And then it's pretty good results. From A2, gone to OM3. From A1, gone to OM2 or OM3. And the colors is nice and even, really nice and even, if you notice that. 2 weeks, I think that's a very good result. And Tom is very happy to show off his new smile. Emma, we did it in 2013. Also, just want to teeth whitening done. So we also did 2 weeks. We've done hundreds, if not thousands of these cases, just to show you. Okay, those are really easy. The yellow teeth are really easy. Now look at some difficult cases. I'm very proud to show off some of the cases by my students, which is this is Dr. Zheng from China and Wenzhou. And she's a qualified, we said a certified Dr. Wyman Chan, dentist. I do a lot of training in China, spend a lot of time there now. And this is a very interesting case. And this patient, Mr. Yu, 68 years old, and only don't know why he started to care about the aesthetic of his tooth. And he told Dr. Zheng that he had this tooth for 40 years now, since root field had an accident, root field trauma, and just lived with that tooth for 40 years. So maybe he decided that he wanted to make a tooth whiter, so he wished to change the tooth color to match the rest of the adjacent teeth. And that tooth can see C4 is so much darker than C4, so much grayer than C4. And I actually help Dr. Zheng. I do a lot of treatment planning now for dentists in China. That's what I do. We provide treatment planning, like Invisalign. That's what I do now. We're like Invisalign. The dentist send us the photos and send out a lot of work, X-rays, and then from there, I ask them to do a few other some other work, and to analyze the teeth, so I can give them a very precise treatment plan and to the color that they want. So this is only traditional treatment. This is of choice. Is internal bleaching. What is internal bleaching? Just quickly go in there. We open a hole from the palatal side, because that has got a composite filling, and then we remove the GP points, the root field all the way down a few meters, 3 millimeters below the bone level, the crest level, and then we fill up with GI, and then we put hydrogen peroxide or sodium perborate or whatever you have in your hand, and then we seal the cavity. Also keep our finger crossed, and hopefully the teeth will go white. That's what we do. This is a treatment of choice. But we decided not to do that, because I haven't done internal bleaching for at least 9 years now. The last time I did probably about 2012. So we do a non-invasive. We don't even drill. So I advise her, I say, let's try this method, because it worked really well with me. So we're using a customized trays, and this is only 2 weeks. Review the patient. I was quite shocked. I didn't realize it worked so well. And because the patient only treated one tooth, and then when we put onto a mixing pad, there's some excessive gel, so the patient put a little bit next door, and then put a little bit on the canine, and this teeth got whiter as well. So I thought this is amazing result in 2 weeks with external bleaching. no internal bleaching, no walking bleach, no inside outside. There's so many ways that the traditional way of doing it. This is purely non-invasive external bleaching with tray, with perfect tray. Okay, let's look at another interesting case, a traumatized tooth, a sound tooth. So what would you do if the tooth is not refilled? You see that, you can see, you can tell. What are the treatment plan for Olivia? Olivia came to us when she was 18, presented herself with a discolored tooth. She said she knocked a tooth 10 years ago when she was 8 years old and bumped into a wall, and only realized this about a year ago, the teeth started to get discolored, getting more and more discolored. Traditionally, we can do porcelain veneer on one tooth if the patient just want one tooth to be treated, or you can do porcelain crown just on one tooth, depends on what they like to do. But in this case, offer a also traditionally, we also can do internal bleaching. I've seen this, I actually seen this in articles that some of my colleagues, they open up a hole, do a refilling and do internal bleaching, and the result is very good. They actually match it to the color of the tooth next door. It's very good. But Olivia says she not only wants the tooth to match that, she wants the rest of the teeth to go white, including that, and including the front teeth to go whiter as well. So to do that, so we offer teeth whitening. So just 3 weeks. We have a system called Get Your Smile, which is a paint-on system. We use that. This is an amazing result we have. Just 3 weeks. Look at the dates: 16th of February and 9th of March 2010. From A1 we'll go to OM2. From a B4 we'll go to OM3. The canines B4 will go on to OM3. I thought that was amazing result. And non-invasive. We don't have to drill a hole, don't have to do a root filling, and do not have to put a restorative and palatally on that too, or non-invasive from here to here. I thought that's amazing. And we got it about 18 shades whiter. And she's very happy, Olivia. How about fluorosis? It depends which area you come from. If you come from an area the water not treated, you have fluorosis. For example, here, this is moderate, it's not severe. So the patient is not happy about the uneven shade with white patches because he's getting married and want to take some nice photographs in Bali, in Indonesia, so that want to have the teeth whitened so that he can smile. Now he doesn't like to smile because of the color of the teeth. So there are many different ways that traditionally, a lot of dentists would have done or would do microabrasion. So what is microabrasion? Microabrasion, for example, teeth like that, then we use strong acid. Traditionally, we use 18% hydrochloric acid, and nowadays we use 35% phosphoric acid with a bit of a pumice, make into a paste. And then you use a slow handpiece. You use a brush and then to brush it in. And you can easily remove even 10% of the enamel if you're not careful. So this technique is very abrasive. So we've got to explain to our patient, microabrasion, enamel microabrasion actually is taking layers of enamel away. And it could be 10% of the enamel, can be a lot. So this is something we need to tell our patient, that microabrasion is taking enamel away. It's just like putting a burr on here and just drill away. I think that's faster using a burr rather than using this method. You should do that. Okay, you can use microabrasion with this technique, but David said doesn't like to lose any enamel because I've been waited for so long. I want something different. How about resin infiltration? Resin infiltration, that means we fill up, we apply resin in this area, and then how do they change color? It's by the alteration of the refractive index, because this area much more porous than the normal. That's why they look the white patches here. So the resin infiltrate into this area and then just change the refractive index similar to the rest of the teeth. That's why the color looks similar. But this is making teeth yellower, not whiter. So David said, no, I want to make a teeth whiter. I don't want my teeth to look yellower. My white patches become yellow. So that's another option that David rejected. So I say now we have two other methods left. We can do porcelain veneers or can do non-invasive teeth or whitening. And obviously, David been waited for so long, 38 years. So he say, I want to do the non-invasive way. Let's give it a go. So 4 weeks we did that. I was really shocked when I saw David back in then, I think 2013. Not only the white patch is nice and even, I saw that there's quite a lot of remineralization as well. All these white patches disappear. So beautiful. So if you got a system that can make a teeth white and also do some remineralization, isn't that wonderful? And David is very proudly showing off his new smile. Angel, 30 years old, quite severe. The fluorosis, you can see a lot of white patches there, very, very opaque. And then you got very dark brown color there. And then you can see a lot of pits as well. The enamel, actually, quite lots of lesions there. Same we can offer. I offer Angel the four standard treatment: microabrasion, resin infiltration, porcelain veneer. She rejected all of them, and she said she wanted a non-invasive treatment, which is a teeth whitening. So we did that 4 weeks as well. I thought that's a pretty good result, but I'm not happy with the result. But I told her that we need about 4 to 12 weeks to make it really beautiful. But Angel says she's so happy with her teeth, so I could not ask her to spend more money to have more treatment. I think this look pretty good, but it gives it a bit more time. This can look even more amazing. But Angel was so happy with the treatment. You can see that all those not that obvious anymore. It's a lot of remineralization going on as well. Okay, let's look at tetracycline stained teeth. This is very severe, very how would say, a lot of these in the Far East, because the Asians, especially the Orientals, the Chinese, and they like to take medications. So that's why they took a lot of medication. This is a 58 years old. Patrick came to see me with moderate tetracycline stained teeth from Hong Kong. Same thing, I offer porcelain veneers. This is what we could do for a patient. We could do veneer, we can do crowns, we can do non-invasive teeth whitening. And Patrick said, I've been waited for so long. I just do not want to. I want to see a dentist. So I want to improve the aesthetic, or the dentist say, no hope. The only hope is we have to do veneers or crowns. So he actually bumped into me in the exhibition in China. And then he started asking me about whether I can do anything about his teeth. And then I said, yes, you come to London and see me, and then I will do something. And then 6 weeks later, he came over to see me all the way from Hong Kong. And I'm very happy. So 6 weeks, we make the teeth from a D3 to OM3. And now he's showing off his smile. Now he's keep topping up. His teeth is OM1 now, much whiter than OM3. He chop up every 6 months now. How about severe tetracycline stained teeth like this? This is a very nice story I'd like to share with you. Thomas, 39 years old, Caucasian. One Friday he went to a party, and in a party he bumped into a dentist. And then, we are dentists. We go to a party, anyone know that we are dentists, they will come around and ask for free advice, always. And Thomas, exactly the same. Went up and the dentist, he was a dentist, he's a dentist, and say, oh, I've just been to Harley Street that afternoon. And then I'm going to have my teeth veneered because I got these tetracycline stained teeth now. I can afford it. I just want to look good. And they even contour the teeth for me so that make a shape for me that was slightly small. And then I don't have a name of this dentist, but this dentist probably been to my course, my seminar. And he told Thomas that before you have the teeth grind down and veneered, he said you should go and see Dr. Wyman Chan. Maybe he have other options for you. So Tom called in Monday and make an appointment, and very curious, coming in and say, what can you do for me, Dr. Chan? Say, everybody say only veneers or crowns can improve the aesthetic of my teeth. I say that we have a third option. We can do non-invasive teeth whitening, but it would take a while. As a veneer crown, maybe 1 or 2 weeks, your teeth will go white, but need some grinding of the teeth, maybe a little bit invasive, could be minimal, could be more invasive, depending on whether it's veneers or crowns. So Thomas said, are you serious? I mean, you can make my teeth look better without grinding them down. I said, yes, I can. I could. So we started the treatment. I offer him a 12 weeks, a 3 months regime. So the teeth are pretty dark, C4, A4, C4, A4, you can see that. And baseline. And 9 weeks later, we got pretty good result. And then 12 weeks later, we got very good result. And say we could go on. And then I asked my colleague to file down the composite filling being put here, because otherwise it will affect my treatment. So, and then I asked Tom to find a dentist, and then just have the contouring done there, because that is maybe too thin, maybe it may break. So Tom is very happy. Okay, and not only I can make tetracycline teeth white. This is one of my students, Dr. Gao, in Beijing. He's done many cases. It's done dozens of cases now. This is one of his very first tetracycline cases I'll show you. Now he works so much better. Just I'm so proud. I'm so proud of the students that I taught in China. And Miss Kong, 35 years old, prefer a non-invasive solution of a smile. So Dr. Gao, I guided him. I gave him a treatment plan. I gave him a 4 months treatment plan, but he did all this in three months. So I think that was really impressive. Another certified dentist, Dr. Ouyang, who's a PhD in an orthodontist, got a PhD, work in a private clinic, Pretty Smile Dental in Beijing. And we were working together, and they do a lot of fixed braces. She does a lot of Invisalign, but her colleagues, two other orthodontists there, they do mainly fixed. And this is what they discover after they done the fixed braces. They found that the teeth demineralized. That's what they realized. They asked me, can we do anything about this? I said, yes, I've been looking into this. I've been doing some work on this as well. I say, why don't you give it a go and see whether we can change the color and make it more even. The patient's just not happy about the unevenness. The teeth are nice and straight, but they are not sightly because of the white patches. Started when she was 19 years old, and then 2 years fixed braces. So she did just 10 days, just trace with the products, with the teeth whitening products. And when she showed it to me, I couldn't believe my eyes. I was shocked. So I mean, we can do things like this now. So the scope is enormous now, what we can do with hydrogen peroxide. So this is an amazing result. Only 10 days. Imagine if we do 2 weeks, 2 months, what the result can lead to. Okay, and many people say, how long can it last? It can last a long time. I think it lasts too long. For example, this case, we have 2010, before the canine, and then after we're done the treatment, it's gone to a B1, the canine, and the front teeth from A3, A2 gone to 1M1. And then the patient hasn't had anything done in 8.5 years and came back for review. And I was surprised and also quite pleased to see that it lasted quite long. I see the color obviously gone down slightly, but still A1, gone down B1, but 8.5 years, it's still so much whiter than what it was before. This is 8.5 years. Obviously, I have many 2 years result, 3 year result, but 8.5 years. This is the longest I have for a review. Nicola, born in 1990. She got a white patches there. A very interesting case. So I'm going to show you this. You can see a tooth has so many different colors. I just want to look at what color that white patches is, and then it show me is OM3. So I know that I need to get a teeth to OM3 to make that white patches just disappear into the surrounding of OM3, just like magic. So the aim is to make the teeth to OM3, and that will disappear. Okay, so came to see me 2009 when she was 21, and then came back. Nothing done before. Came back for another treatment, another retreatment 5 years later, and you see that is not there yet because there's no OM3 yet. So you still can see the white patches there. or maybe the mineralization hasn't taken place. But then came back to see me 2019. She came back in 2016 as well. So you just come back every 5 years for retreatment. And that is nearly disappear. But I just saw her. I'm so pleased when she booked an appointment. I was stuck in China for 9 months. I came back. She wanted to see me. When she came in, I was so happy when I took the crystal eye. That's totally gone. I know that I've gone into OM3 now. It's gone. So beautiful. The white patch is not noticeable now. So imagine that you start with that, and 12 years later, your teeth is still so beautiful. They do last a long time, and they can last forever if you chop it up every year. So let's look at the scope and limitation of teeth whitening. Yes, we know that it cannot align teeth. So if the teeth are crowding, we cannot change that. Yes, we know that if the tooth shape is not ideal, we cannot change that either, but we can change the color. That we can do. We done a survey in 2010 because at that time an orthodontist worked with me, and I try to refer. I try to upsell after their teeth whitening done. I ask them whether do you like to have if the teeth are not straight or crowded, whether they have orthodontic treatment done. This is try to refer to our orthodontist. I found that 82% of the patients are happy just with their teeth whitening, even though they are not straight. Not those really crooked teeth. I'm talking about like mild crowding. They really don't mind. But in my experience, when the teeth are nice and white like OM3, they look really nice, even though we have a little bit unevenness. They look so natural, really natural. And I think that 82% is a big proportion of our population are happy just to have the teeth whitened and nothing else done. Obviously, I think it's a cost as well, because if you do orthodontic treatment, the teeth whitening, maybe between like 500 to 1,000 pounds. We're talking about orthodontic treatment. Here is about 6,000 pounds. It's a lot more. So I think probably it's a cost as well that put a lot of people off having to have the treatment done. And thank you. I started 10 minutes earlier, so I got plenty of time for questions. Thank you, Andrew. I'm ready to take questions.
Thank you, Dr. Chan. If there's any big questions, if anybody wants to pop it in the chat now for Dr. Chan while we've still got him.
Yeah, I think there's a lot of chat there. Let me have a look. Okay, let me see.
Anyone online want to ask Dr. Chan a question?
Okay, to say thank you so much, but no question. Okay.
Lots of compliments, obviously.
Okay, this is thank you for the great presentation. Did you use any additional material to mineralize the teeth? Very interesting question, because many of my students ask me that. The answer is no. But it's all in the products. It's all in the products. If you use good products, it's a science, and some products can it's not the product that do the remineralization, because in the products there's no calcium, no phosphate, but you could have something. You've got something that will encourage the phosphate and the calcium and phosphate from our saliva to deposit it onto the teeth surfaces. That is the key. That's the secret, and that's the magic. Okay, that's a great question.
Thank you. Do we have any other questions for Dr. Chan?
Okay, if there's no question, I'd like Andrew, I'll pass it all back to you.
Thank you very much, Dr. Chan. We really appreciate your time today.
You're welcome. I'm looking forward to see you back in Birmingham soon when all this pandemic is over.
Yes, I hope so too. Just for the record, Dr. Chan also whitened my teeth, and I can vouch that the results were absolutely amazing.
I also teach at the College of Medicine and Dentistry, and that's why I teach MSD students. If you guys want to learn more about teeth whitening, please enroll. You're going to be an amazing teeth whitening the dentist, as well as an aesthetic, as well as a restorative dentist.
Thank you, Dr. Chan. That's great.
Okay, I say goodbye and thank you. And thank you for watching. So if you want to get hold of me, you can get through Andrew, and Andrew got all my contact details.
Thank you, Dr. Chan. That's great. Thank you for your time.
Oh, you're welcome.
Thank you.